My name is Dr. Minx, and I'm the clinic director here at ACS. I'm from the suburbs of Chicago, and I went to undergrad in Indiana at DePauw University, DePauw with a W, not the L. And then I went to chiropractic school in St. Louis at Logan University. I spend a lot of time at the office. I really love what I do here at work, but I do like to take time away. And when I do take that time, I really love to golf. That's one of my favorite things to do when I'm out of the office. I love getting together with friends and playing and being outside. And then the competition component of tournaments or just kind of matches with friends. But I also like to stay active. I did CrossFit for a long time, so I love weightlifting and staying fit. And then any chance I can to get out to a lake or be on the water is one of my other favorite things to do outside the office. At a really early age, I can remember being fascinated by science. In 5th grade, we dissected a sheep's heart, and I just thought it was the coolest thing. And so as I went through schooling, I just had such a draw to human anatomy and biology. And so I knew I would kind of set down some path with medicine. But I also had a passion for sports. I played softball, volleyball, and basketball in high school. I played softball in college, and I wanted to kind of blend my two big passions together. And I was very fortunate to have the experience with a chiropractor early on that helped me extend my athletic career. And so I thought, maybe I should pursue that path and be able to help athletes like I was once helped. So my role here at ACS is clinic director. And when I was going through chiropractic school, I only wanted to work with athletes. I really just had such a passion for sports medicine. But as I got into my career, I realized I wanted to do a little bit more. And so I had the opportunity to join ACS to be able to take on this position where I'm still on the clinical side. I still get to help patients, but I'm also on the business side where my responsibilities are to make sure that our operations are efficient. I get to lead a team of people, and then I also get to impact our growth as a business. And I never thought that that role was possible as a chiropractor, and I really love the role that I now get to play being on that clinical and business side. And I think now what's special is instead of just impacting one patient at a time as a provider, I get to help create a place that gets to help a lot of people at one time. I've worked with athletes at multiple levels. I've worked with high school, college, and I was even fortunate enough to work with the Chicago Bears for 3 years. There's something really special in being able to help an athlete return to play or perform at a higher level. But at ACS, we have a neuropathy program. And really the way this program started was we were tired of listening to patients tell us that there weren't any other options for them. So we came up with a solution for them, and we put together this program that is getting just amazing results. We get patients who come in and they share these stories with us that they can't feel their feet, they can't feel the difference between cold and hot, or they can't sleep at night because their feet are burning. And so to be able to change that for patients, and they tell us that I can now actually shower without having to hold on to something, or I can get a full night of sleep because my feet aren't waking up. That to me is so special, to be able to help patients return to a higher quality of life, or to get rid of their fear of falling because now they can actually feel their feet underneath them. If you just want a different experience at a doctor's office, I recommend that you come here. You're gonna it's going to be something like you've never had before when you've stepped into a doctor's office. First, our office doesn't even look like a stiff doctor's office that has, the white walls and you just kind of feel like you're being herded to the next office or the next provider. Here, you're going to be greeted by your name. People are going to remember who you are and facts about you. They're going to ask you how your day is. And you're going to have providers that just sit and actually listen to you. And you're going to feel that they're fighting for you to get the answers that you're looking for and to come up with a plan to really treat the pain that you're dealing with and ultimately what's bringing you through the door. And you'll see patients that want to keep coming in even though they're pain-free and they've accomplished the goals that we set for them at the beginning of their treatment plan. But we tell them, like, it's good, you're feeling better, but it's time for you to go. And you can tell that they're reluctant for that to happen because they've made friends through their whole process of being here at ACS. One of the things that's really unique to us here at ACS is that we have multiple providers under one roof. What's really special about that is we get to collaborate together. Every morning we have a meeting together where we review new patients from the previous day. We go over any patients that are maybe not progressing as we want to. And we get all this input from the medical providers on that patient care. And it's also, ultimately, in my opinion, it's a very efficient healthcare model because you're getting all these different opinions and perspectives for the patient. But then also, if a patient needs another evaluation, they're being treated for their shoulder, but then all of a sudden they hurt their knee over the weekend, they don't have to call the office and wait 4 or 5 weeks to get scheduled. They can just come in and say, hey, you know what, I hurt my knee over the weekend. Can you take a look at it? And hopefully we can get them in to see one of our providers. In the same regard, if instead of having to go to this place and this place to get your physical therapy and to get an injection, is that you get it all here in one place. I feel strongly that we are changing the way healthcare is done for the patient. We take a very patient-first approach here. We create plans that are individualized for them, meaning that it's not a cookie-cutter approach. It's one patient isn't going to have the same plan as the next one. We have very comprehensive plans. So if a patient comes in with knee pain, we're looking at things in a bigger picture. Is there a lack of hip stability? Is there the arches collapsing in the foot? We'll find those answers so that we're treating patients completely versus just very focused on their pain that they come in with. And then ultimately, it's very innovative, and that's in all of our approach to the way that we have multiple healthcare providers in one place, how we have provider meetings to make sure that we are providing the best care for our patients, complete care. We also have very cutting-edge approaches to our treatment options. So that's our PRP injections that we offer. We have a brand new neuropathy program that's helping give patients answers and options to their neuropathy that they have otherwise been told that there's nothing that can be done for them. So ultimately, I think that the way in which we do things here is changing healthcare.